I'm Dr. Shruti Laya. I'm a postgraduate student from Kakatiya Medical College, Warangal. Regarding NTB screening, I don't think it is uh, necessary or even feasible to screen all the people, because in an endemic country like India, it is going to cost us a lot. So, family active screening of contacts of patients would be better. That we are doing our best. But the problem is there is still a stigma. And you'll be surprised to know how much stigma exists within medical fraternity itself. Like, other than doctors who are treating TB patients, who are dealing with TB patients, you'll be surprised to know how much stigma exists among the medical fraternity itself regarding TB or RVD or whatever it may be. So I guess that should be broken. Awareness should come among medical fraternity first, after that to the general public. And it's good enough if we screen the patients contacts, like active TB cases. It's good enough if we screen their contacts, I feel like that. And yeah, that way we can find out a lot of cases. After that, effective treatment. One more challenge we are facing is patients tend to default treatment because it's such a long treatment. Like, for drug sensitive TB it's 6 months, for drug resistant it goes up to 1 year, over 1 year. So they tend to default treatment. And when you tell someone that, if I tell you that you have to take one particular drug for 6 months, you're obviously going to forget for some days, and you cannot afford to forget taking TB medications. So that's there.
It's a very important point which you made about the stigma within healthcare facilities.
Yes,
I think
definitely.
also what can be done, because doctors should be knowing best about, if we put patients on treatment of infectious TB, lung TB, then in 10 days they will become non-infectious.
No,
So
that is there.
How can we reduce stigma within healthcare setting? Because so far we speak about the stigma which patients face, but
Yeah.
there is a stigma within healthcare facilities also, which is a barrier, right, to care.
Yes, I'll tell you one thing. The problem doesn't lie only within the medical, only among the doctors or something. If there is a hospital, if there is a tertiary care setup or something, we need to have separate setups for these infectious patients, so that others don't get infected or it doesn't spread, something like that. And we should be teaching people how to deal with those infections, hand hygiene and stuff, and then they can be dealing with these set of patients. So that is one thing. If that comes into regular practice, and if people see, if your juniors see you working like that, and their juniors see them, and their juniors see them, it's going to come along with the practice. It's not a change that can be made in 1 or 2 days, I
So
feel.
true. It's so true. And so let's hope that the stigma ends.
Sure.
And you are able to find TB. How do you find TB in your medical college? Do you use molecular tests, microscopy?
The first step is always a microscopy. It's a state government hospital. It's obviously resource limited setting, but the first step is always a microscopy, and we do send NAT for all the patients. But another problem is reports. NAT takes only 1.5 hours, 1.5 hours to give the results, but it takes like 2 or 3 days to get our results. After that, the next step is a little challenging. If we try to send LPAs or cultures, we do send it, but getting the report is a little challenging in a government setup. I can't speak about private setup. In a government setup, this is a little challenging. So
And it takes time to.
yes, definitely.
And how much is the delay? Like like, is it after getting a positive correct diagnosis? So what is the duration after which the person is initiated on treatment? Just average, like it takes a month.
No. We do start treatment on the same day
On the
itself.
same day.
See, microscopy result is just going to take 5 minutes maximum. You just go and give the slide to the laboratory, and they're going to tell that, ma'am, this is positive. We straight away start the treatment. That's all.
Wow, amazing.
NAT is going to take some 2 or 3 days, and we just start the treatment like that. And,
Really wish there are more doctors
thank you.
like you.
Thank you.
Thank you. Well, you're as a young doctor and upcoming medical super specialist. So, what is your message for World TB Day, which is on 24th of March?
I don't know if I'm qualified enough to give a message to the society or something, but I just wish the stigma ends. The stigma really bothers me. I don't know if I am a respiratory physician. I deal with TB patients. I deal with non-TB patients also. So in our side, like my friends and my seniors, there the stigma is a little less, but stigma from other people, it kind of bothers me. So I think awareness should come regarding that. So that,
Thank you
yeah.
so much.
No
Let's
problem.
move for what you said.
Thank you.